for civilian providers out there who are going to see veterans who return to their communities to get care after getting treatment in DOD setting like Belvoir, Fort Belvoir, Bethesda, they should know this, that veterans are medically, I would say, is a little bit different as far as their attitude, makeup, their approach to problems. I would say there's a lot of emotional scars that they've gone through. Some of the scars have not been touched yet because it was impossible to address them because of all these different medical problems that were more urgent that needed to be taken care of. Or they were aware of them, but it was too fresh or not appropriate time to address them. So I will say that the lesson number one is always assume there are emotional scars that have not been addressed. I think they have to be very sensitive and at least aware of that, or try to appreciate those before they begin the treatment. Because oftentimes I see, at least from my experience dealing with veterans when I was in civilian side, I found out into the treatment. And many times I had to reverse or at least the treatment did not become effective because I was not aware of those emotional scars, which is fairly common, even people who do not have PTSD. If they were deployed, if they actually were in some kind of combat setting, it's easy to assume, it's actually important to assume that they have some emotional scars. I would say that's the biggest thing. Number two is they have a mentality of an athlete. Most of the time they minimize their problems. So they might not actually tell you exactly how they feel. So when they say headache, there are other things there. If they say back pain, it's usually more than that. They're just going to be very specific to a problem, but they don't elaborate unless you really dig deeper. So interview has to take a little bit longer, or at least give them time to kind of present their problems to you. And they have a hard time trusting medical providers. So you have to, again, put them in the driver's seat. Give some time to develop the rapport before you really force your treatment plan to them. You really have to have a buy-in before you actually do something with them.